Hi, I'm a respiratory therapy student. My name is Claudine to go over some vent initiation and patient assessment that goes with that and vent checks. So let's say we have a neuromuscular type patient where he's a quadriplegic. He's coming in due to some seizures. He's a 53-year-old male. His respiratory rate's like 24 and labored. Um, his ideal body weight's 178 pounds, so that makes him 81 kilograms. So these guys like a little bit of a larger tidal volume. So if I do a 700 milliliter tidal volume, I can get a flow of around 42. So I'm turn my Draeger Evita XL on. It's loud and it's not happy. I don't have half the stuff hooked up. I should. So. So we know he's coming to the ICU, and he's already been intubated and he's being bagged. So first thing we're gonna do is make this thing go quiet. I'm gonna have his 81. Nope, too far. Is there still the glare? No, there's much less of a glare, but I'm less in it. Hold on. Better. No matter where I go, there's glare. 81, perfect. All right. We're gonna click start. Okay, so right now I'm in SIMV. That will work. So he can breathe over what I set. Let's do some settings. Let's go 700. Go to 100%. 100%. We're going to lower that as their O2 sats get up in the 90s. Respiratory time. And then go to 1. Ooh, frequency. Let's go up. It's on 11. I don't know why. 12. Okay. Additional settings. Flow triggers 2. Perfect. Terminations 25%. That'll work. Alarms. Common inhalations 11. That'll work. Apnea, we're going to have to go to 15 for the settings here. I don't know why it doesn't. You can't automatically program that for your hospital's protocol. That would be nice. He might need, let's just say this isn't working well, and let's say he needs a little more PEEP to get better oxygenation. So we can, I've got it yellow. I turn that up. Let's go to 8. Dang it. I touched the button at the wrong time. Turn the oxygen down just a little bit. Let's go to 90. Low pressure 45. That'll work. I'm actually getting a tidal volume of around 600. So I would record everything that my vent is doing. Once the patient gets settled, when they're first on it, before the medications and stuff have kicked in, is not the best time to do it because they're still agitated, the nurses are moving around, and you don't get a good baseline of what they're doing on the ventilator at first. That'll work with autoflow. So that's going well. So I would watch my patient's vital signs, heart rate, blood pressure, any signs of fighting the vent. So they're coughing, they're gagging, they're too awake. I really hate that glare. So I would get a chest X, they're going to do this anyway, but do an ABG to see where they are when they first come in. Dang it. When you first put them on the vent, and later after they've been on it, say an hour or so, to see if you're making any improvements, if you need to make any adjustments. Do the cuff pressure check with my manometer. Listen over that to see if I hear any gurgling or any secretions or anything that sounds like there's air coming around the ET cuff. It may need air added, it may need air taken away. So there's your balloon. And I want that to be right around 20. I can inflate it with that, or I can let air out with the red button on the side. Assess the breath sounds, make sure they're equal bilaterally. With him having been a quadriplegic most of his life, it's probably going to be atelectasis in the lower lobes because that's probably his normal because he just doesn't have the good chest wall movement to get good ventilation going. That'll work. I'm getting an FiO2 of 91%. That's neat because I set it on 90. Let's see what else can I think of. 1 second, 4 seconds. Perfect. I can increase my respiratory rate to increase my minute ventilation a little bit. Let's get a 14. You go about 2 at a time. Oh, they got me. I got my peak pressure up to 37 and my alarm's at 40. So let's turn my peak down. That'll work. Minute ventilation around 8. Mean airway pressure around 14. Resistance 19, which it's a fake lung. It should be fine. Compliance 24. Tidal volume around 640. Yes. Apnea. Triggers 2. Autoflow is on. We're assuming it's an ET tube of 8, which that's actually off. There we go. My respiratory rate's 35. My apnea's 15 seconds. My high tidal volume's over a liter. Let's go down. Just a little pat on that. Let's go 900. That'll work. All right. I think that covers everything for the initiation and a couple of changes. I really don't like that airway pressure very much. Let's go 650 on the tidal volume. Yep. That's not changed my. I guess it's the fake lung that's causing the high airway pressure. Yes, I'm aware there's no CO2 sensor. There's not going to be. Wouldn't read anything anyway. I guess it would read the air. There we go. That's better. I got my peak pressure down to 34. 33. That's better. I like that. Perfect. So there's my actual settings at the very bottom. And the graph up here is what they're actually doing. So since I am an SIMB, I can alter that and breathe over the set rate. Yeah, and that just made my minute ventilation go high. Nice. That'll work. Thank you.